All right, it's 12 o'clock. We'll call a special meeting of the Board of Supervisors, June 26th to order. One item we have today is a report update on our COVID. Director Burley.
Good afternoon, Chairman Johnson, members of the board. Thank you for the opportunity to speak today. I'll start off, as I always do, with the numbers. Currently, we have 886 cases in the county. And we still continue to see a growth in cases, a large growth in cases in the Bullhead City area. That's where we tend to see most of our growth at the moment, although we are starting to see some additional cases in the Lake Havasu City region as well. I was asked if I would provide the average age of all cases, so I did want to provide that. And that is 51 years of age is the average for all the cases that we've experienced so far. That's the average age. The average age of deaths in Maricopa County is 78.8. So you can see it's a little bit on the older side, of course, even though we have a number of new cases of younger individuals. The recovery rates for those individuals is usually higher because they don't tend to have the underlying health conditions. So looking at hospital capacity, I think that from the report this morning, it looks like Havasu Regional Medical Center is at a place where they've maxed out their current standard ICU bed availability, which means that they would move into an expansion of that ICU capacity if need be, if they had the additional patients coming to them. We have, just to be clear, received some patients because our hospitals do have capacity, unlike some areas. There have been patients that have been transferred from other communities to our hospitals for COVID-related services. I don't have an exact number of that at this moment, but I can speak to where they're coming from, and you've probably heard this on the media anyway, so that would be from the Tucson area, from Yuma, and I believe those are the two main areas that they're coming from. So as those hospitals fill to capacity and their ICU bed availability is extended beyond, then they're beginning to use this Arizona Surge line, which is a request line to transfer people from one hospital to another to ensure that they get their appropriate care. Any questions on that or on the hospital report?
Any of the board members have any questions? One question I might have is, are the people coming from the other areas, are they, Havasu's the closest one? Is that why Havasu's full, or are they going to the other hospitals which have more bed space?
Certainly. So I know that Havasu Regional Medical Center has received some of those patients, and then I also am aware of some Kingman Regional, some that have been transferred to Kingman Regional Medical Center, but I'm not familiar with the other two.
Thank you.
Certainly. And as I talk about numbers, I apologize, I want to go back a little bit. There was a question posed by, I believe, Supervisor Angus and yourself about elective surgeries and testing for elective surgeries. So I'd like to clarify that, if you don't mind, here. And that is that a person who is tested for elective surgeries, if they come in and they're tested and they test positive at that point in time, and they have a very small window to be tested in order to be eligible to continue to move forward with that elective surgery. If they test positive during that time, then they need to come back in 2 weeks and be retested. And so there was a question as to whether or not those were counted again in our case count if they tested positive again, and that is not the case. So once they are tested, if they are tested again and still considered positive, those results go under the current case. So they're not repeated, and they're not counted again a separate time. So only counted once. Okay? I wanted to speak to testing availability in the communities. I've received phone calls from leadership in Bullhead City and from some individuals within the Lake Havasu City area about trying to increase testing availability. And we are working with ADHS on that particular issue, particularly as they have the ability to kind of use other resources that we do not have available to us. I think I mentioned CVS as a possible option for sites where they may have drive-through services, so I do know that they are checking into that for all locations within our county. And we do have the Fort Mojave CVS offering that service currently, but to expand that to all the other communities that have that. And then we're also clarifying some language with ADHS as it relates to elective surgeries and hospitals and their ability to request supplies from the state and the county. So once we have that all situated, I think I'll have a report that I can provide you, which is hopefully an ability to kind of see a growth in the availability of testing in our communities all throughout.
Question on that. That's not going to be free like the blitzes. That'll be charge-based for those.
Well, I can speak for the CVS particularly at the moment, and the way they've structured it is if you have insurance, they'll bill your insurance, but if you don't have insurance, then the test is free.
Thank you.
That's what I've been told so far. So if that changes, I will certainly let you know. Let's see here. Looking at the hospital capacity, and kind of coming back down to that again, just the question about the hospitalized cases that are listed on the ADHS website at 131. I think I didn't look this morning. That was yesterday's number. So if that's changed, I apologize. And then the disposition at the time of the report that we report on our daily reports to you, and the discrepancy between those. So we count a case as hospitalized if they are hospitalized at the time we investigate, when we first investigate the case. So this really helps us because we need to provide that information to all of you, and that's what we've been instructed to do, so we have to kind of pull what we know at that moment. ADHS counts if they have ever been hospitalized during their time. So a person may during our initial investigation, not be in the hospital and be hospitalized, but eventually need hospitalization later. And at that point, they would need, that would be counted, and that's why the discrepancy in the ADHS count.
So we could have more than what's being reported on the ADHS site.
ADHS actually has the higher count. Right now, what we have are 90 who are hospitalized at the time of disposition, and ADHS has 131 cases that were hospitalized ever. So when we reported, they were not hospitalized, but during that time between our initial investigation and the time that they hopefully have recovered, they've been hospitalized during that time frame.
Thank you.
Mm-hmm. Okay. All right. For staffing, I want to thank you again for approving those positions on Monday. We've started the recruitment process, and those positions are currently posted. We've also reached out to HR to help us with recruitment specifically for the nursing positions, as we understand those may be more challenging to fill. But they'll be taking some steps that may help fill those positions more quickly. But we'll keep you up to date on our hiring and how that's going. We've also been in touch with ADHS regarding our current staff that are assisting with this effort and whether or not they can continue to work on this or whether or not they'll have to transfer and transition back to their program activities. And these are specifically grant-funded programs that have given our department and counties permission to stay funded by the grant but be providing COVID-related services. And so we do have permission from some of those programs to continue allowing staff to work on COVID-related activities past the July 1 timeframe. So they will be in contact with us and keep us informed of what changes during thereafter. But hopefully we can continue to use that because, as I mentioned before, that was 12 of our staff that are currently assisting on various levels. And you just reminded me, Supervisor Johnson, I have that chart for you with the names. Basically, what it is the areas that a person is working in, so warehouse, investigations, contact tracing, et cetera, in a short definition. So I will have that to you by the end of today.
Thank you.
Mm-hmm. to build on some of our education efforts, we're going to be using some of our community health educators to be point people for schools and for certain types of businesses that we feel may need some additional assistance and some education. And we would like to be a resource for them. So we will be looking at some of those individuals that have that education background and experience and utilizing them in that role. Additionally, we'll be looking at our environmental health crew when they go out, and that team, to bring with them the requirements for restaurants and bars provided by the Executive Order 2020-40, provided by the governor, and those requirements for restaurants and bars will be provided to that business as we are inspecting them, and we'll at least review them with them at the very least, to ensure that they understand them and that they're doing their best to follow those protocols. Let's see here. We're still encouraging people to use face coverings while out in public, and when unable to social distance, we want to continue to encourage that with the general public and all businesses, because that is a way for businesses to keep their employees healthy. By not sharing and not spreading, and that keeps a business healthy as well. When they can have their employees there, when they're providing services to the public, that's, I think, their bread and butter and how they make their money. So we'd like to keep them economically feasible and moving forward. Beyond that, I do not have any other specific updates, but I'm certainly open to questions.
Thank you, Director Burley. Do we have any questions from board members? Supervisor Watson? Supervisor Angus?
Not today.
Supervisor Gould?
None today, sir.
All right. I have a few questions today. Aside from folks with medical conditions, is there any health risk to a perfectly healthy individual from wearing a mask?
Generally speaking, I would say no. I mean, I think there are individuals who may have some uncomfortableness wearing a mask with breathing and so forth. They may not have any underlying health issues that cause that, but there may be other reasons. And in that case, I would say that would make it difficult. They could hyperventilate or be very uncomfortable in that situation, yes.
Okay, because we've seen some people are putting out that, oh, the oxygen level goes down with the mask wearing, but we did a test through our own office where we saw no drop in oxygen going to the person at all.
Mm-hmm. Right.
Okay, with the shortage of surgical masks for the general public, is there a specific material folks should be looking at for when they purchase a cloth mask covering?
There actually, if people go to the CDC website, they actually provide instructions for making face coverings and face masks. And I would recommend that people utilize that site as a resource for design and information about materials to use.
All right. Been contacted by a few constituents regarding early voting because some of our poll workers are in vulnerable age group. Would you recommend that we at least require those working early voting in the polls to wear face coverings?
I do, and I always circle back to it's a preventive measure that people can utilize to keep people safe, and we recognize there's a lot of individuals experiencing very mild symptoms and they may not be aware that they're sick, and so it's a way for them to prevent the transmission of the virus to others that are coming in to vote at that site.
All right. Have you heard of any hospitals or other health departments about what the long-term health effects of COVID are for those who have recovered?
I think the science and research is really still out on that. I think it's very early in the process. There have been a number of things mentioned, but not in large enough quantities and in mass to really be able to say definitively that it was COVID related. So I think we're learning a lot as a result of all the research being performed right now, and we'll continue to monitor that.
Okay, we keep seeing more and more studies on the connection of blood types and COVID-19. Have we got any more information on that, if it's affecting the blood?
I did actually very briefly read an article on that, and I don't know that I could speak to it authoritatively, so I'd like to do a little bit more homework, if you wouldn't mind, and then I can bring some information back.
Sure. A few months back, you were skeptical about the accuracy of the antibody testing. Has your opinion changed on that, or is it still the same?
Well, you know, for public health, we're really looking for those PCR tests, because that really tells us if someone is positive, and they're still, well, I think the validity of those tests has improved greatly over time. I still think it doesn't really tell us a lot about the long-term benefit and the immunity of that person. I think there's still a great deal of question about how long a person is immune if they've had it, and we don't want to ever give anybody a false sense of security to say that because you've had it through the antibody test and you were positive in that way, that then that's protection. Right now, that is not something we can say with confidence. So I think it's moving in that direction. Again, more science, more testing, and more validity being added as we go along the way.
All right. We've said in the past that the children would not display adverse effects and symptoms to the virus, but we know more and more of that is borne out that might not be true. For children testing positive, what are we seeing in regards to symptoms, and is there any long-term effects that we know of yet for the population under 18?
I think there are a few different concerns there. I think with the younger kids, we are still seeing more mild symptoms. The nurses have not reported to me any particular cases specifically to Mojave County where where that child has been hospitalized, for example. So in many cases, they're seeing mild to moderate symptoms. I do know that there are some concerns about the Kawasaki disease and how that has a long-term consequence for those younger populations, and there has been information provided to health departments and out to the public about that potential issue.
Okay, and kind of going along with that, but also for the older people, the people are not being offered any kind of pain relief or anything else for this disease or this virus. They go and they get checked and they're sent home to quarantine for 14 days, and we call them up, and I'm understanding some of the pain is just excruciating, but they're told to take aspirins. I mean, nobody's giving them any kind of relief at all?
Well, you know, I'm not sure what the doctors are prescribing. I know that most of, I'm guessing that a majority of the people are being asked to take over-the-counter medicines to address pain and headaches and some of the fever and some of the other symptoms. But I think those are made on a very individual level by physicians and based on their determination of the need.
Okay, but wouldn't those people, if they're sent home to quarantine for 14 days, obviously the doctor's not going to want to see them back again coming into their room.
Yes.
I'm guessing the chances of them getting any kind of medication are pretty slim.
Just to kind of add to that, you know, many doctors are either doing telemedicine appointments, or they are, if it's a follow-up, many times that patient can talk with a nurse practitioner or nurse, get information to the doctor, and then that doctor can reassess that decision at that time. So there is opportunity afterwards. It may be limited in terms of the availability based on that provider or where they receive services, but yes.
Thank you. You kind of touched on it when you were giving us our update on the approval of hiring the 17 additional positions. If someone locally wanted to apply for one of those positions, how would they go about doing that, and what are some of the qualifications for a contact tracer?
So all of the positions are currently posted on the county website, so go through that site to apply for the positions. And what we're looking for specifically is an attention to detail, critical thinking skills, because we need them in terms of investigating potentially and asking the right questions, knowing what to ask. We'll provide them with a foundation of that, but sometimes in the course of an investigation and contact tracing, you're given pieces of information and you're looking to kind of build on that, and you need to know what kind of questions you can ask. And while we can provide that foundation, I think it's helpful if people have those other skills that they can that they can utilize those while they're in the conversation with them, rather than having to refer back to a nurse or someone else. Additionally, we're asking, the positions are open, are available for 6 months. We'd like people to know that those positions, that's what we currently have permission to keep those people on board for. But we really want people to commit to that time frame and not just a month or two, because we need that kind of continuity and consistency within those positions to maintain the operations.
All right. Bullhead went from having the least amount of cases to the most. Is there any one specific event you contribute this to, or maybe the reopening of Laughlin having anything to do with this?
Well, we haven't actually been able to tie any of the cases yet to Laughlin reopening, but I think just the reopening in general, there's been no specific event in Bullhead City and that area that we could point to that said that that was a real problem. We've had cases related to a variety of different activities, but what we're finding is many of these have been more family gathering type things and friends and family gatherings, and that one person or two people that are positive spread to that particular group.
Okay, you touched on it before where you said the average age has dropped from 52 to 51 now. Do you see that continuing to go down?
I do. I do. I mean, the growing number of cases that we have in the younger age groups, what you're seeing is this transition from before, when we saw a lot of cases coming out of long-term care facilities that were affected, and we know the average age, of course, of those individuals is much, much higher, and now that we see it out in the community, and I believe there's maybe a perception that they're not as adversely affected as others in an older population, so it's no big deal maybe to get sick. I would say that that is, for some, maybe the case, but I think for others, they may have symptoms and consequences of that far exceeded their expectations.
So that'd be kind of contradictory to what we first came out with when we were hearing nationwide that we were one of the top 5 counties to be hit the hardest because of our aged population, but it appears that maybe the elderly people are taking precautions and the younger ones aren't?
Correct.
Okay, we keep seeing more and more restaurants closing, supposedly for cleaning because they had an employee or a customer test positive. While some restaurants are volunteering this information, some are keeping the information hush-hush. For the safety of residents and travelers, shouldn't the county be putting out the information if we are seeing an outbreak linked to a specific restaurant or location?
Well, there's a couple of different philosophies around that. The one is that we try to provide the minimum amount of information to protect public health. And in some ways, if by providing that information out to the public, we would potentially be identifying a case, especially if it's a small business. Secondly, it depends on what you consider an outbreak, for example, in a facility. If you have 1 or 2 people in a business, I think what you're going to find is that list is growing exponentially of the number of businesses that are affected by that. And to list them all would, and not only just a few that people want to know about, would be problematic for us to do. And I think irresponsible in that light. If there's a serious public health threat, just like we would in any other environmental health case, we would certainly notify the public and make them aware. But we learn that as part of the investigative process, and that's where, during our investigation and contact tracing is to learn who might be affected by that particular employee or by employees.
Well, it kind of seems like we went from protecting the person's identity to protecting long-term care facilities' identity. Now we're protecting business identities, and we're not giving the information out to, at least what I see, the people that need it. Because I get people who will contact me, and I'm sure as other supervisors do, saying, it could be a rumor. I heard that X restaurant employee came down with it and they've closed down now for cleaning. What should I do? Isn't that something that maybe if we put out and say, yes, this place had an employee or a person came in who had it, however we do it, and there's no worries for people who have been eating at that restaurant in the last 7 days or anything? It just seems like it calms the people down more than starting to panic.
Well, and I definitely understand that, but there's some considerations there as well, is, until we investigate the case, and even when we investigate the case, we may identify only one day where that employee worked, and then people have to recall when they were there and how long, and were they around that particular staff person, and they wouldn't necessarily know that. So we could actually create more worry also in that case. And what we are finding is that most of these particular businesses that you might be referring to have been incredibly responsible in their actions as far as closing their doors and taking the necessary steps to clean their facility, ensure their employees are healthy, and then making sure that when they reopen that they're prepared to do so.
I guess where that's the problem for me comes from is because I can see if somebody has gone out to eat and then we don't tell anybody that this restaurant has been closed, even though they're taking all these precautions and there's really no chance of you getting it. We're not calming the fears of the multitude of people who might have been there, so I guess somebody's going to be hurt there, have their feelings hurt. Hospitalizations around the state continue to climb. Yesterday, Arizona set at 88% of ICU capacity, and you've mentioned that we're already getting people, transferring people to Mojave County. Can you tell us what happens when the state hits the 90%?
I'm not sure. Originally, the 80% number was thrown into the equation as part of their waivers, the hospital waivers. I'm not sure of the next step in that process, but I will learn more about what that looks like, as far as 90% or greater.
All right. The national trend
I have a question, Chairman.
Did we have a question from a supervisor?
Yeah, I do. I can wait till you're finished.
Oh, that's all right. Go right ahead, Supervisor Angus.
Okay, so Supervisor Johnson talked about, how we're now segueing from the older population, and now it's kind of going into the community and spreading to younger people with less mild cases. And isn't that the way it was supposed to go? Isn't that what we were told the whole time, that, in order to get the herd immunity, it's got to have to go into the public and it will be watered down? And isn't that kind of precisely what we're seeing right now?
Sure. So Supervisor Angus, I think that when it comes to herd immunity and immunity in general, we would say that for many other diseases and illnesses that you're trying to build that. But because this is a novel virus, they're still trying to assess and research herd immunity and immunity in general. And so there's a lot more questions and answers about a person's immunity level once, if they've been in contact, the exposure, the time of exposure, whether or not they've been positive. There's still a lot of questions about whether or not that person will have immunity and for how long. And until the science again kind of catches up a little bit, which I hope is not too far off, we're still guessing, if you will, or what would you say, your best estimation of how that might play out in society. Yes. Okay, so you guys, you have your investigators and your tracers and things. So you have, after 2.5 months, you have to have some data that says where it's going and the severity of it. I heard Supervisor Johnson talking about, excruciating pain. I'm not doubting that at all. I haven't heard that as to be a typical symptom, and I'm sure that if that is, that doctors are there. But I think that if we're doing these investigations, at some point we have to have that kind of comparative data. So are we there yet, or at what point do you think we're going to be there? And as far as Bullhead City, not going to minimize it, we have boomed, but we also were kind of the last to have a lot of testing for whatever reason, and now we have testing everywhere, and everyone's going to get a test, whether they have, no symptoms or some symptoms. So I frankly am not surprised by the numbers at all, but to me it is the severity and how it's traveling. So at what point will we have that information, or are we just doing tracking and tracing to make sure people know if they've been exposed? Well, we do monitor people's symptoms that are positive and close contacts, so we would have some of that information. I just have to learn from our epidemiology staff whether or not we can extract that information and then provide you with some data that's reliable. So I will certainly check in with them.
It's not that I want you to go out of your way and spend time doing that. I just thought that would be part of it, that whether the state would want that or is Arizona Department of Health doing that? Because at what point do we stop being, afraid and saying, okay, everything, and I understand what you said about it, it's a novel virus and that we don't really know, but at some point it tracks a certain way and then the experts can get information from it. It seems like we haven't really moved the needle too much to understand it. And so we're just kind of in this thing where we're seeing more cases and people are not hearing that, it is going to younger people and the symptoms are milder and that kind of thing, which I think all information is good. I think people should get as much information as possible.
Absolutely. I'll check with staff on that, Supervisor Angus, and make sure that anytime you ask me an EPI question, I always get back with our EPI staff to figure out if we can get that data to you. And I can tell you about how long it would take, and you can tell me whether or not we need to proceed, okay? So happy to do so.
I appreciate it. Thank you.
Certainly.
All right. The national trend has more men coming down with COVID, but in Mojave County, way more women have come down with it. Is there any reason why?
There's no definitive reason why. I think as you're seeing some of these younger cases, you might sort of think that could be mothers taking care of kids, that kind of relationship piece and the role within a household, but nothing else specific and no other specific reasons why.
Have we figured out if this is, I know we're still under investigation, but is it going to be flu-like, and will it come back every year, and can people be reinfected?
They're still doing the research there as well, and that goes back to the immunity of whether or not somebody can be reinfected. It's unclear at this point. They are anticipating that this will come back in the fall, and it will come back at the same time flu season does, so the similar symptoms piece will be much more difficult to tease out. Additionally, we're moving into mosquito season. We're there, and as a result, we're monitoring for West Nile in our community and along the rivers especially. And West Nile symptoms also mirror flu and COVID symptoms. So we're hoping for no West Nile cases, by the way.
All right. I think my last question has to do with on our website, we have a lot of graphs that people really appreciate. Is it possible that we could get some graphs to show, I was asked about, like the deaths for when they started, and so they can kind of keep track to say, oh, we're seeing more deaths now or we're seeing less deaths now. I think it's pretty sporadic with the deaths, but I was asked that.
So if we could talk a little bit about what you'd like that to look like. Is it over time? Like
yes.
Okay. Yes, I think we can do that.
Okay.
We might, if it's okay, depending upon how it looks, do it by week, because I think that data would be more significant and apparent.
Right, that'd be fine. Supervisor Angus, do you have any other questions?
No, sir.
Supervisor Gould?
No questions, sir.
No questions. Does the board want to do anything about the early voting, address that issue, or something we want to think about, because early voting's coming up rather quickly? All right. Hearing nothing on that, the last thing I'd like to do is I think we have our new county manager, Sam Altiers, here for the first time. Maybe they can show a picture of Sam, and so people know who to hate. All right, with that, we're adjourned. Thank you.